Hello, this is Dr. Khan with the Animal Hospital of Chetek again. Today we're going to show you a little bit how we prepare a dog for anesthesia. This is Candy. She's from the Humane Society. She'll be up for adoption in a couple days. We're going to spay her today, but first we have to prep her. So the first thing we do, and the most important part of anesthesia, is pain medication. So our technicians are about to give her dexmedetomidine and hydromorphone, 2 forms of pain meds. We do this for every surgery. Anyone that requires anything that's going to be painful gets these medications. They go IV, if we can get it. Sometimes they have to go in the muscle, IV being in the vein. Some dogs will just get a little lightheaded with this, others will pass right out. Occasionally a dog might vomit, which is okay, it's expected. Oh, good girl, Candy. And this is the same thing that happens to all of our patients during pre-anesthetic protocol. Okay, she's starting to get a little tired. The next thing we do is we place an IV catheter. So we're going to shave her arm. Placing an IV catheter gives us venous access during surgery, just in case something goes wrong. Oftentimes during surgery, blood pressure will drop, which will make IVs or intravenous access a little harder to obtain. So in an emergency situation, it's always best to already have a catheter in place. Emergencies don't come up often, but when they do, we're very happy to have these. Again, it is going directly into the vein, so we have to sterilize it first. Okay. Alright, a little bit of blood means the IV is in place. We have to tape it in to secure it. Now Candy's going to be hooked up to an IV line, so we're running LRS, it's a fluid. Having fluids going during surgery helps us control blood pressure. It also keeps our patients hydrated. Now that the IV line is in place and the fluids are running, we can actually give the induction agent. This would actually get them in a plane where anesthesia is possible. Pain medications alone are not enough. As you can see, she's still moving a little bit. She's not really feeling any pain, but she's far too awake to do surgery. We're administering propofol. It's a very good induction agent. It's also known as the Michael Jackson drug. Once all the propofol is on board, Candy should get very tired, and we'll be able to intubate her. Intubation allows us to both protect the airway in case they do vomit during surgery. They won't swallow any of it back into their lungs. And it lets us control the level of anesthesia. The tube is tied around her nose to keep it from slipping back into her airway. And she's now hooked up to gas anesthesia. This is an isoflurane. We now put lube in her eyes just to protect them. Under anesthesia, eyes can dry out pretty quickly. And now that she's under anesthesia, we go ahead and clip all of our patients' toenails as a courtesy, and then we'll prep them for surgery. We're going to shave her at her space site. Okay, and now that she's been prepped, we'll move her to surgery. That's actually a 3-person job, so I'm going to have to help. Okay, Candy's been moved into the surgery suite. We're now going to hook her up to all of the anesthetic monitors we have available. Starting with our pulse ox. This is a measure of how much oxygen is in the body. We then attach our capnograph. This is another way to measure oxygenation and perfusion. If oxygen levels drop too low, well, that can result in brain cell damage or even death. So the point of all these monitors is to find problems before they happen, then we can adjust our anesthetic rates and our fluids rates to prevent them. On her left hand, a blood pressure cuff has been attached. And finally, a electrocardiogram or ECG is attached. The surgery table is heated to prevent hypothermia or getting too cold. When patients get too cold, they tend to shunt blood, which can lead to cell damage of vital organs. Once we check the machine and make sure everything's running well, we place an esophageal thermometer. Okay, Candy is all set up. From here on out, she will always be monitored by a certified veterinary technician using this monitor. It's a similar monitor that you'd find in a human hospital, if not the same. You guys know the rest. You've seen our spay video. If you have any questions, feel free to email us or call us at 715-859-6650. Alright, here we are with Candy. We're 24 hours after her spay. This is what a dog with good pain medication should look like. She's very happy. She's a very friendly dog. If you are interested in adopting her, she is available at the Barron County Humane Society as of Saturday. Once again, this is how a well-pain medicated dog should look like. And thanks for watching our anesthetic video. Thank you.